Good morning. Dean Mazzarella is my name, and Mayor for the City of Leominster. The COVID-19 update. It is March 24th, and it is a couple minutes past 9. This is our morning briefing. If you have any questions regarding anything this morning, and you're on Facebook, you can Facebook those questions, and I'll answer as many as I can. Let me go to our slides. People have found the slides helpful, simply because they can make copies of them. Okay, I've been taken over by something here. Okay, here are the cases in Massachusetts as of yesterday at 4 p.m. As you know, I think both the governor and every other press conference in the news has stated that the more testing, there's substantially more testing going on at Health Alliance, that we will see the cases go up. As of yesterday, there was one confirmed coronavirus, and this morning on the way here, there was another confirmed. So that is 2 cases here in the city of Leominster. There were 777 reported throughout the state, and in Worcester County, as of yesterday, these are yesterday's number, there were 42. And as I said, there will be many, many more, simply because there's more testing, and then Reliant will go online this coming Wednesday. Here are some important phone numbers if you need to take a quick picture of that. Those are the important numbers to remember here locally, and that's exactly why we do these briefings. We take all of the information we gather during the day and afternoon and sort of sift through them to see what impacts you locally. Mayor's Office, 978-534-7500. Remember, the school department is working with Chartwells. They are doing meals for students, and that's 7 to 9 at different locations around the city. I will mention that in another slide. MART will be limiting Council on Aging rides to grocery stores, medical appointments, and pharmacies. This will be effective tomorrow through April 7th. MART will also not be charging any fares during this time. And for rides, call the Leominster Senior Center at 978-534-7511. At every single municipal building, you'll find a list of services along with phone numbers and the department. And if you get there and there's something that you absolutely need, remember, forms for the most part are online. If you really, really, really need something, it's vital, it's important, call any one of those numbers. Somebody will come out and meet you. We'll get you the information. We'll either mail it to you, get it to you right away, et cetera. But you know, we are open, and we will be scaling down somewhat, but city government will continue to be in operation as we are a vital service. Again, the school department, here's their hotline, email address, 7 to 9 weekdays in terms of school breakfast and lunch pickups. Johnny Appleseed, Francis Drake, Leominster High School, Fall Brook, and we also have lunches at the City Hall in the event that you can't make it to one of these locations, and you could come to City Hall anytime between 8:30 and 4 o'clock. The school department is doing a great job working with Chartwell, and I know that teachers are anxious and to get and keep their students up to date on what's happening and keep their little brains going, right? United Way has launched the United COVID-19 Fund. Funds will assist local agencies to help those hardest hit, deal with basic things like food, childcare, and housing. 100% of every donation goes towards helping. Grants will be made to help families impacted by the virus to meet basic needs. It will also help local agencies continue their good work on behalf of area residents. United Way is also partnering with the Department of Public Health to provide consumer assistance through 211. That's 211 is a 24-hour hotline. Donations can be made to Stand United COVID-19 Response Fund at uwncm.org or text COVID help to 50511. More information will be coming this afternoon's briefing. And basically, if there's anything that I mentioned this morning that you can't write down quick enough or take a picture quick enough, you can call our office and we'll get that information for you. This is standing by our office in the event that you need it. Any info on where in Leominster the 2 cases were confirmed? No, that is not under the HIPAA law. That is not something that we can share. That's the law. They have relaxed the law somewhat. They've relaxed the law, the HIPAA law somewhat, so that there's an address at dispatch in the event that any emergency medical people or public safety folks go to that home. At least they have at least a little bit of a warning as to what safety precautions they may need to take. Okay, business that can stay open. Here are some of the places that are exempt from the governor's order. Now remember, Leominster is a manufacturing community. Some of the businesses have received federal status that they need to continue. This is through the president, that they need to continue operation. And others are manufacturers, provide materials, equipment to the construction business, which is vital, to the healthcare industry. So there are all sorts of things that are critical. And so while we talk about what might be sort of a critical need or who might be vital to the operation, it really does go, the list is pretty long here in the city of Leominster. When you get into the inner city, and a lot of it is either high-tech or whatever, it doesn't have the manufacturing component, then obviously that doesn't affect them as much. But for us, there are many businesses in this community that are going to be exempt. Today's schedule in the mayor's office, we have an LTV press conference right now. The Mass Mayors Association conference call with the governor, lieutenant governor. That's coming up this morning. A United Way conference call, Health Alliance conference call, and our city department heads will also be having a conference call so that we can stay underneath the 10-person maximum. I was speaking just a minute ago about the companies that are designated by federal government to help with COVID-19. The federal, thus far, we know of 2, but I believe there are more. Foster Tech and International Rectifier are both companies that are designated under the president's order to help with COVID-19, and they have a direct correlation and connection to what's going on in this country. So they are ordered to remain open and run, I believe, all shifts. New for business, a lot of things that are happening. So if you've been told that you are going to be laid off, as a number of companies have already sent that information out, a number of are about to. But anyway, Mass Hire, DUA, and Mass Hire BizWorks have programs that can help. The best thing to do is to try to get this information. Try to fill out online applications, because I know that even though they have a phone number that's at the bottom there, you're much better off to try to do this online. Get these forms filled out. You can file for unemployment benefits online. And here are some of the sites that you may want to visit that I know will definitely help you out, because the backlog on the phones is pretty incredible. And you don't want to get caught up in that. I apologize. Again, I think this message has been put out just about everywhere. Paper towels, napkins, wet wipes, baby wipes, facial tissues. Please don't flush them. All of the public works, water, sewer, treatment plants are being affected by this. So again, please refrain from putting those into toilets and flushing them. If you have a loved one, a senior citizen in the community, and we have this great program at the police department. It's called the Are You OK program, designed for senior citizens, medically disabled persons, or shut-ins who live alone and need to be checked on daily. Call this phone number at 978-534-7560, 3432, and dispatchers call every number daily at a designated time. If there's no one answer, if nobody answers after 2 times, they send a police officer to check on them. It's a good thing, both because the person actually gets a phone call and there's somebody checking, and if somebody doesn't answer the phone, then after 2 times, they will send a police officer. Here you go. Here's the schedule for both Health Alliance and Reliant. First, if you have symptoms, call your doctor. After the doctor, and now they're doing, they did tests yesterday from 10 to 2. I understand from Health Alliance it went very well. Everyone cooperated. It went very smoothly. Again, the numbers of confirms are going to go up simply because of the amount of testing that is being done. So you need a doctor's note. Then you need to call this phone number. It's 978-466-2627. It's really critical that you call that phone number so they know you're coming, they know what kind of car you're driving, they can get you in line, process you quickly, and get you back to home. It's located under the parking deck at Leominster Health Alliance, so if you go in from North Main Street, just across from Longhorn, you just drive in straight into the center road, you go up, and immediately you're going to see some signs directing you. Again, that's 10 to 2, Monday through Friday. Also, at Reliant, they start tomorrow. So you need to contact Reliant directly, and their testing is for Reliant customers only, those that are part of their plan. So there'll be 2 testing sites here in the city, and as I said, the more testing, the more confirmed cases we should receive. Employee business assistance. If you have any questions and you have a business, 978-534-7500, 3579. Chamber of Commerce, northcentralmass.com. And a reminder that the Chamber has a loan program up to $20,000 to help businesses. And also, again, just a reminder for unemployment claims, www.mass.gov/DUA. Some high points here from the federal government, working with national companies in the production of PPEs and respirators, bringing 2 medical ships to New York and California, stimulus package, implementing the 15 days to slow the spread plan, identifying and changing regulations that stand in the way of supplies and progress. On the state level, again, we'll have an update from the governor. We have a conference call today as well. Gloves, PPEs, personal protection equipment, beginning to come in, working with the Army Corps of Engineers, coordination with child care for emergency personnel, finalizing details of the $20 million package for small businesses, and continue to expand telehealth and addressing regulations that get in the way of services. City buildings continue to remain closed. But if you have an issue, there's something that we can help you with, by all means, call us. That's why we're here. We're public servants. We're here for you, and we want to be of service in any possible way to help you get through the process. I try to oversimplify it, but this is a disease that doesn't like soap, and it doesn't like alcohol. So they're your best 2 tools, right? Hand sanitizer or alcohol, and washing your hands. There's that social distance sort of rule. It's for a reason, because most of this is being transferred by either air, close proximity, person to person, sneezing, etc., droplets, however you want to sort of use the term, but that's exactly what's happening. So think of that. Assume you have the disease, assume everybody you come in contact with has the disease, and assume everything you touch is somehow or another compromised. So clean things frequently, cover your mouth when you sneeze or cough, stay at home if you're sick, and think about caring for you and your community. And this is really one of those things that we have to really look at and think that one person can give it to 2 or 3 other people, and those 2 or 3 other people can give it to 2 or 3 other people. And that's exactly what's happened in other countries. That's what's going on in New York. People live close together and in dense populated areas, and you can see that in fact has been part of the problem. So let's think about each other. So if you do work, and you do have to go into work, constantly be wiping down surfaces, stay away from other people. And if that means moving your office around, or ask your supervisor, whoever, they should be making sure that nobody is working close together. And so keep in mind, if you can do those things and you can keep yourself surrounded by soap and and alcohol, and I don't mean that kind of alcohol, then you will minimize your impact. Here's some of our partnerships. I left the screen up for a minute so you could see. Want to thank all of these doctors who gathered their supplies for us so that we could provide assistance to the Health Alliance and as well as those in local public safety. And I want to add to the list, because we did take in donations from Adams Tool. They provided masks directly to the Health Alliance. United Solutions did the same thing. O'Connor Companies, thousands of Tyvek suits and masks, thousands, so that we could equip our local public safety offices and firefighters, emergency technicians, et cetera. And also Sue Zephyr and Ginny's Helping Hand that brought us a truck full of things that you can't get at the grocery store, like eggs and milk and other things that they brought yesterday. And I have to say, didn't even put it out on the tables. People were great. They came in, they went right into the truck themselves. They were not hoarding, they were taking what they needed, and it really worked out well. And if anybody else has any other donations or connections to the food industry, or anybody else that might have a surplus, or a restaurant that has food that, you know, they're just not going to be able to keep, rather than have it go bad, let us know. We'll do the same sort of thing. It really worked out well. Also want to thank Jeff Richard at R&S Hauling and Excavating. Again, he owns a company in town, and he went up and donated some masks for those in public safety and the healthcare. Wi-Fi at the public library. Just go to the rear entrance on Pearl Street and free Wi-Fi. So drive in and download your messages. So senior shopping hours, I think the word is pretty much out. Market Basket, that's going on right now. Also Wednesday and Thursday. Open for those 60 and older, 5:30 to 7. Shaw's, Tuesday and Thursday, 7 to 9. Target, the first hour of shopping every Wednesday at 9 a.m. for seniors. Walmart is an hour early before they open every Tuesday. Hannaford is 6 to 7 on Tuesday, Wednesday, Thursday. And hopefully that helps. But really, if you're a person that's elderly, and especially if you have a pre-existing condition of some sort, you should have somebody else doing your grocery shopping for you, because this is, nothing to mess with. This is, most young people get it and sometimes never even know they have it. But for the elderly that might have another condition, another health concern, this could be, this could be a real challenge for you. There are a number of medicines that I keep reading up on that seem to have worked in other countries. And in fact, I heard testimony last night from a couple different good sources that said that it worked on people that were near death. And, they are giving credit to some of these drugs. Testing is moving quicker and quicker all of the time. Eventually, because this virus isn't just a virus that's going to end on a particular day, this virus is now with us, and it might not be to the same extent, but it is with us. And eventually you will go to the doctors or a clinic or wherever, and you prick your finger, they'll take a little blood sample, they'll be able to tell whether or not you maybe already had this. There are a lot of people that have already had this virus and don't know it, didn't know it. And so you'll be able to tell whether or not you are, whether you had it and whether you're susceptible to it. As I understand it, or I've at least heard that more likely if you've had it in the past, and you might not be as likely to get it again. But that's all information that will be shared later on by people much more intelligent than me in the medical world. But things are looking up in the sense that there's more testing. The tests are coming faster. Instead of waiting 2, 3, 4, 5 days, the tests are coming faster. That means we can get those that test positive, we can identify them quicker, get them into quarantine. We can then, and as fast as we can do that, start to treat them with medicine. And again, every day I hear of another treatment, then that is just going to help us all. And I know that the governor will be on at noon, and I'm hopeful now that maybe by the first week of April that we will see a significant progress. We will have made significant progress in reducing the number of those who have contracted the virus and diseased. The fear is that the hospitals don't get so overwhelmed. And can you imagine somebody that works in the healthcare industry and they're being taxed to the maximum right now? They're treating people, in fact, for weeks they were treating people that they had no real test to be able to give except for the more severe cases. And so, for them, working in the healthcare industry or those in public safety, they were helping people that they didn't know if they had it or not, and had minimal protection in many cases, in many instances. Think about leaving work and coming home. Are you going to share that with your kids? Is there a sick or elderly person that you're taking care of? And so all of that is sort of taxing everybody in that industry. But the real fear is that twofold. One, if our hospitals become overwhelmed and can't handle, there are only so many healthcare workers. I can't go out and train another 1,000 people tomorrow to become doctors or nurses or professionals in the healthcare industry. So what happens is, that's one fear, and the hospitals get overwhelmed, and the people that are caring for them can't keep up with it. And two, what about everyone else on the other side who have been put off for doctor's visits, have other health concerns, but those have sort of been put off to the side. And if this is going to be a true pandemic and the hospitals are overwhelmed as well as overtaxing the medical system, then what happens to who's going to treat those people who have other health issues that aren't related to the virus? That is why we continue to stress that the whole issue of keeping distance between each other, cleaning surfaces, using soap constantly, anything made out of alcohol that you can get to sort of sanitize yourself, and good hygiene and staying healthy. And that's why people stress it over and over and over again. I just want to go to that last slide if we can. There you go. The volunteer list. If you'd like to volunteer, this is the phone number to call, 978-534-7500, extension 5055. On the other hand, if you need some help, you need somebody to shop for you, call the emergency management. They staff the Emergency Operations Center until about 8 o'clock at night. Please give them a call. Don't forget those who might live near you, or those are the people that are sort of remaining in the home, self-quarantining themselves, and they may need some assistance. And the greatest generation of all is oftentimes reluctant to ask for help and try to do it on their own. So, check in on them. If there's something that you can do to help them out, today's a good reminder that snow is heavy and wet. Send the kids over, let them know that you don't even have to tell them. Just shovel out their driveway, shovel out their walkways, whatever is needed. I'm just going to be here another minute, so if there are any last-minute questions, I'll sort of go through this real quick. Seem to be the questions that were surrounding. If you've just joined us, we do have 2 confirmed cases here in the city of Leominster. One was confirmed yesterday and one on my way here this morning. We are notified that there are confirmed cases, although it is against the HIPAA laws to give addresses. The police department and dispatchers are given it. Those are held in confidence. That way, if they are dispatched to a particular location, they have some advance warning. However, if you are in need of medical assistance or you need law enforcement agency to respond to your home, do us all a favor. Let them know. Dispatchers will ask you a series of questions, but offer as much information as you can so the officers, firefighters, and those in EMS will be protected. That is critical and helpful, and they need to know what they're responding to as well, and so it goes both ways. We are continuing to work on projects here in the city. There are departments within the city that must move forward with projects that we've started, and here are just some of them right here. I'll move to the next page so you can see some more of the projects. People are still working. Government continues to operate, and I'm really hopeful that in the next couple of weeks we will see a slowdown and begin to return back, especially as the weather gets nicer. I can see that spring itch to get back out there. So if you're completely bored and you've already gone through all of the old 8mm films of your grandmother's weddings, then fill out the census form. You could do us all a favor by doing that. Do want to thank, as we do every day, to all the first responders, all those in the medical industry, all of those that are caring for others in nursing homes, assisted living, home health care, DPW workers, and all the city workers and school department staff that have been responding since this all began. And I'll say lastly that, oftentimes we are asked to plan ahead, and looking through the current pandemic plan that emergency management rolled out to us about 3 or 4 weeks ago, looking at it really did make sense, and we are appreciative and thankful that we took it serious, that someday this might happen, even though in the back of our minds we thought maybe not. But all those tabletop exercises we've asked others to participate in, businesses alike, really have helped us in terms of being prepared. And my motto has really been simple from the beginning: prepared, not panicked. And I think it's worked. Lastly, I want to just say that nobody has been nasty. Even though this is something very serious and important to everyone, and it's scary, people didn't let scary turn into ugliness, and I'm appreciative of that. Everybody has been respectful and helpful and kind to each other, and I know social media can get goofy once in a while, and but the reality is, on our end, people have been patient, as patient as we can expect them. They've been helpful and thoughtful, and so for that, I thank you all. We will be back here at 4 o'clock this afternoon. Remember, assume you have the virus, assume everybody you come in contact with has the virus, assume everything you touch has been compromised. Soap and water and alcohol are the two things that the virus hates the most. Use them plentiful. Thank you to WLPZ, radio station 95.1 here in Leominster, for broadcasting this over their airways, and they continue all day long to provide these updates through the radio station. I want to also thank the whole crew here at LTV, who gets up bright and early to get down here and make sure we can be on, and stays late in the afternoon to make sure that we can do these briefings, and then later stays and takes apart the whole studio. I want to thank them as well, Leominster.tv. And again, you can find everything that's happening in the city, local programming and everything else aside, great historical programs that are on here at LTV. So thank you, Leominster.tv. We'll see you this afternoon. Take care of yourself, stay healthy, take your vitamins, wash your hands, and carry a bottle of alcohol with you, and scrub everything down. Thank you.